All right. Thank you all for joining us today. My name is Morgan Saya. I'm a senior program manager here at the National Safety Council. Today's webinar is presented by our SAFER program, which is an initiative founded during the pandemic in early 2020 and funded through the CDC. The initiative started out putting out a variety of content on topics such as mask guidance, incentivizing workers to be vaccinated, physical distancing, returning to work, and more. We now have shifted into emerging topics that came from the pandemic, such as hybrid remote work, employee wellness, substance use, DE&I, and mental health, and more. These topics have been around, but have been heightened by the pandemic. So today we are excited to have a discussion on BIPOC and mental health to raise awareness about the distinct mental health challenges faced by different racial and ethnic groups. And the timing couldn't be more perfect as July is BIPOC Mental Health Month. So we are excited to have our guest speaker, Dr. David Daniels, to speak on these issues, share insights, and discuss steps that we can take. We'll have a Q&A at the end where throughout the presentation, you can enter in any questions you may have, and then we'll have time to answer those questions at the end. And so without further ado, I'd like to introduce today's speaker. Dr. Daniels is an occupational health and safety professional and the president and CEO of ID2 Solutions. He served 2 terms as a member of the NSC Board of Directors and received NSC's highest honor, the Distinguished Service of Safety Board. He's also the host of the Psych Health and Safety USA podcast. So welcome, Dr. Daniels. I'm going to turn it over to you.
Well, thank you, Morgan. I certainly appreciate the invitation to do a little chatting. I'm going to do some screen switching here. I have a couple of slides that I want to share with folks. This is an interesting topic, and it's particularly interesting topic of a few disclosures, if you will. I don't come at this conversation as a mental health provider. And I think a lot of the conversation around mental health in the workplace, those types of topics are being facilitated by mental health providers. I'm a mental health first aider. I have some basic awareness. I have some understanding and some background in the area, but I come to this conversation as an occupational safety and health professional because it's important. Mental health, and we'll talk a little bit about the differences here in just a second, but this is a topic that those of us who are interested in the health and safety of folks in the workplace should at least be concerned about how the workplace affects how people think, feel, and act. And this, again, it was stated earlier that this month is BIPOC Mental Health Month. And that actually was or is an activity that was initiated or is initiated by Mental Health America. So Mental Health America some years ago dedicated the month of July to the memory of B.B. Moore Campbell. So Ms. Campbell was actually a journalist, a teacher, an author, and a fairly fierce advocate for mental health in general, and specifically in BIPOC communities. Interestingly, doing a little research on her, her daughter, Maya Campbell, has been in and out of the news. So Ms. Campbell actually passed away from cancer, but her memory remains alive in these conversations that we have about this topic. But her daughter was actually was in television herself and has been featured in a couple of short documentaries, if you will, regarding her struggles around mental health and her bipolar disorder and such. So these types of issues do sometimes run in families. Sometimes they are a product of our biology, and sometimes they're a product of the environments that people come up in and are exposed to. So first of all, what's the difference between mental health and mental illness. I think that's really important, again, when we have these kinds of conversations, because sometimes folks will take the two topics and kind of smush them together and make the assumption that they're the same thing, and they are related, but they're slightly different. So mental health, kind of like our physical health, doesn't we can be in a state of having really normal mental health but have a mental illness, and conversely we could have not have any illness at all and but still be not having a great mental health day. So mental health has to do with the way that we think, feel, and act. It's psychological. It's our social well-being. It's how we interact with the world. And there are days when we, regardless to our state of illness or not, may or may not be having good mental health based on all kinds of things, what we've been exposed to, what's going on in our lives, what's going on in the lives of people around us. So again, mental health is how we think, feel, and act. But mental illness is actually the health condition. So it's a health condition where whatever's going on with how people think, feel, and act is difficult for them, and difficult to the extent that they have difficulty interacting with others, difficulty taking care of themselves, difficulty with family activities. These are the kinds of disorders that are tend to be listed in the DSM-5. And it's a long list. I certainly don't have the list memorized. Some of you may, but a person with mental illness it has a health condition that's going to affect how they operate. And many of these health conditions do require medication, do require ongoing treatment, and do require modifications in the way people live. But again, no different than a physical illness. Just because a person has a mental illness does not necessarily mean that they cannot function on a daily basis, particularly in the workplace. There can be people in the workplace who have a diagnosed mental illness, but actually no one would know. As long as they keep up with their treatment regimen, you'd probably never know that anything was going on. So there's this, what's called the dual continuum of mental illness. When we think about both mental illness and mental health, they tend to interact with one another. So you can have folks, obviously most of us would want to be in the upper right quadrant, where we have great mental health and we have no mental illness at the same time. But it's possible to have good health but have illness, or have illness and have great health, or have illness and have not so great health. And again, each person is affected differently by these different concepts. Again, mental health and mental illness are related, but they're not necessarily identical. And that's important, because often there is an amount or a degree of stigma that goes along with any conversations around particularly mental illness, or and to a lesser degree mental health. But they're normal. It is normal for all of us to have at some points in our life to have some challenges around our mental health. But we're talking during this conversation specifically about Black, Indigenous, and people of color, BIPOC. And in those of us who fit in that category have some additional concerns that we're going to discuss just a bit. One of those discussions is the issue of unequal treatment. So the Institute of Medicine did a report back in 2002, and this report really had to do with the healthcare system in general, and suggested that there are some differences in the quality of healthcare that people receive in this country, and those differences are not necessarily directly because of the person, but because of the environment that people are in and the communities that we live in. And it is a reflection of how people see the way that we look and see the way that we live our lives. So many of these disparities, again, are systemic. Many have been around for a long time. And some of these disparities have to do with discrimination in systems that were, in the beginning, they're never necessarily, many of them were not necessarily made to be equal for everyone. That's an observation I have about a lot of our systems where there's any unequal treatment. We have to go back to who it was that designed the system in the first place. And a lot of the unequal treatment is not necessarily intentional. Some of it is. It certainly was legal to discriminate against people. As a matter of fact, I believe it was over this past weekend, we celebrated the 50th anniversary of the Civil Rights Act of 1964, which changed a lot in this country. So those of us, I was extremely young at the time, but in my lifetime, it was legal. It was legal to treat people differently based on their race, their gender, their sexual identity, what have you. So the remnants of those systems continue to exist, and they continue to impact folks in terms of how I get evaluated for insurance coverage, and the proximity of medical treatment, how long it takes to get an ambulance. All of these are things that are remnants of systems that were built many, many years ago that have still, in many cases, not been addressed. Again, so there are some decidedly different outcomes that have been found to exist in the healthcare system. And particularly in this, in the report, it talked about the fact that particularly African Americans have poor health and health outcomes than whites in the country, because those tend to be the polar opposites when we talk about racial differences. It was interesting to find out, though, that these differences in terms of health outcomes, physical outcomes, don't necessarily translate when it comes to mental illness and the presence of mental illness. Because the study at the time suggested that BIPOC communities had either lower or certainly equivalent rates of mental illness. So where in the healthcare system, on the physical health side, there are actually lower levels of physical health as a result of the environment. But from a mental health perspective, interestingly, the data suggests that BIPOC communities and the members of BIPOC communities don't tend to have mental health challenges or mental illness that's any worse than the white population. So it's no worse, but it is in effect a system issue. So though I may not have issues biologically, when I'm in an environment, and this is just one example, there are overt serious impacts to racism in the healthcare system in general that can show up physically with poor sleep and higher BMI and inflammation and hormones that don't work the way they necessarily should. So again, as human beings, we're pretty similar, and BIPOC communities don't have any greater incidence of mental illness, but because of the environment, there are certainly physical kinds of impacts to the environment that we exist in that will affect our mental and physical health. Go a little bit deeper there and talk a little bit about some of those disparate impacts. And it's important to have conversation about the impact, because sometimes folks don't realize that these types of things are going on. As a matter of fact, there's a part of me that wants to believe that the average person probably doesn't know unless it actually affects them. Otherwise, it would be very difficult to be able to operate as a human being, believing that everyone around me is out to get me. So I don't personally believe that's the case, but I do believe that we all see the world through our own eyes. We see the world through our experience and the experience of those that are around us, and often don't recognize that not all of the systems that we have necessarily work the same for everyone, because again, they weren't necessarily designed to. So if we were to look back in history, this is that long ago, back in 2012 of the demographics of the United States, we would see the white population 63%, black population 12.3. And again, the numbers are there. Asian population 5%. So demographically, based on the categories that we use in the through the U.S. Census, not everybody's the same. Again, not good or bad or right or wrong, but we're just not all the same. We present differently and categorize ourselves rather differently. But if we took that same, rough period of time, or the period between 2008 and 2012, and looked at mental illness or the data that we have around mental illness is not as equally distributed as we are in the population. Because as you see in the slide in front of you, that the percentage of folks that report a mental illness are different based on their racial identity, but not so widely different, I should say. The range between 13 and 22%. So it's not like 10% and 80%. So again, the presence of mental illness from a percentage basis is fairly equally distributed. But if we dug into those numbers a little bit deeper, we would see that the numbers are slightly different. Black Americans at 16.8% percentage, that's about 6.8 million people, again, that have some documented mental illness. Asian Americans at 13.4%, that's 2.2 million people across this country that have some diagnosed mental illness. Native Americans or Alaska Natives, 22% in total on a percentage basis, but 830,000 diagnosed cases of mental illness. And again, this is all in 2016. And because being Hispanic is more of an ethnicity than it is race, you can have folks who may be racially something and also be Hispanic. So from an ethnic perspective, about 15% of those who identify as Hispanic have some form of mental illness. That's about 8.9 million people. So all of these numbers, they're certainly not there for anyone to memorize. They're to highlight the fact that we do have challenges in the country, not only in our physical healthcare system, but in our mental health care system. And many of these issues have been around for a while. So again, the data I've just provided was pre-pandemic. But let's talk a little bit about in the COVID-19 wake. One of the statements that I personally make, this is my personal observation about the pandemic, is that in many ways, it didn't change everything, but it exposed a lot. So much of what we continue to experience in the aftermath of the pandemic are things that were going on prior to the pandemic that we didn't pay a lot of attention to. A lot of this data was here. A lot of these issues were here, they existed, but the pandemic all but forced us to pay attention. And it, in many cases, amplified some of the existing issues. But again, it didn't necessarily create them. The challenges with our healthcare system are not new because of the pandemic. Challenge that we have with some of the inequality and the disparities, they're not, the pandemic didn't cause them, but the pandemic did highlight many of them. So a number of people said that worry or stress related to the virus has had an effect on their health or their well-being. Folks having difficulty sleeping, appetite issues, difficulty controlling their anger, increased drug or alcohol use. But again, people had issues with their sleep prior to the pandemic. The pandemic, in many cases, accelerated these concerns. The pandemic didn't create high blood pressure, but it did accelerate it for people. Many of those who unfortunately lost their lives were those who already were in ill health. And I also say that many of the businesses that failed were businesses that were already struggling to one degree or the other. And again, the pandemic kind of pushed them over the edge. And when we talk about how this affected, demographic groups, as you can see, the pandemic in and of itself was kind of affected everybody. No one was left out. As a matter of fact, it was, one of the rare occasions in our lifetime that everybody was affected. Nobody got to hide. Now, the severity of the impact was certainly different, again, often based on how people went into it. So people who went into it strong came out, okay. That's a comment that I, again, make about emergencies, disasters in general. They tend to make us more of what we already are. So those who are healthy and those who have plans in place get an opportunity to test both of those. But those who are not so strong and don't have plans in place on how to respond or react don't have the margin to be able to deal with something as significant as a global pandemic. So again, you can see some of the numbers there. So let's take a look again at demographically the United States in 2021. So this is 9 years past the other slide I showed. As you can see, many of the numbers are about the same. The white population was a little bit less, or those who identified anyway. The Black population up a little, Hispanic population up a little. Not a significant difference, but things were just slightly different until we look again at the prevalence of mental illness. It really stayed about the same in terms of the distribution across the various racial and ethnic groups. So again, a problem that we had prior to the pandemic remained during the pandemic. It got a little worse for some, because if we were to compare the differences between 2012 and 2021, you'll see that for every group, our issues around mental health and mental illness in this particular case, things didn't get better. And again, the distribution really depends on the group, but the distributions are such that it got worse. It got worse for everybody. The reality is that our systems, we didn't really learn as much from that study back in 2002. We didn't put as much of an investment in our mental health systems. And again, as the pandemic showed it kind of reminded us about some of the deficits that we already had. One of those deficits has to do with the treatment that people receive. Because though the distribution in terms of percentages is, fairly balanced, in terms of the percentage of people that have mental illness, the accessibility, the availability of treatment is not the same. And it's not good really for anyone. It's not good for anyone. Only white citizens in the United States or white residents of the country report having slightly over half of those that have challenges with mental illness have the ability to be treated. The last figure that I heard is that there are roughly half the population of the United States lives in a place somewhere in the United States that has a lack of access to mental health care. We don't have near enough facilities or near enough mental health professionals to be able to address all the challenges that we have. And again, this is on top of the fact that our healthcare system, our physical healthcare system, has some challenges. And again, this is, this conversation is not necessarily meant to be the quote unquote Debbie Downer. It is to say that if we're not going to treat our way out of this, we're not going to even in many cases not going to therapy ourselves out of it. It's going to take both those lagging indicator approaches, dealing with the damage after it's done. We really need to be thinking about prevention, because we don't have a system that's going to be able to treat everyone who ultimately ends up with mental illness if we simply wait around for people to get treated. Uh, Another issue that's kind of worth mentioning is the fact that ultimately death by suicide is becoming a more and more uh, present issue. It's something that there is more conversation about. As a matter of fact, many industries are starting to recognize that they are losing people from their industries. In the example being in the construction, that you are more likely to die by suicide. You're about 4 times more likely to die by suicide than all the other conversations that we have about falls from heights and all kinds of other things. So it's not that those physical issues are not important. They are very important. But we also must consider the fact that we are losing lots and lots of folks due to deaths from despair, suicide certainly being one of those. And the lack of an effective system is making it more difficult for Black, Indigenous, and people of color. So the thought is, if we have a system, the systems that we have should be designed and focused on making a difference for everyone. A rising tide will lift all boats, assuming people are in the boat and that the boat was designed for them. Because a rising tide for people who don't have boats will simply drown them. So let's talk a little bit about some of the ways that BIPOC mental health can be supported. And it's interesting, in doing a little bit of research around this topic, I came across and actually know some folks who work at a company called Lyra Health. I don't work with them, but do know some folks who work there. And they're over the past few years, one of the a company out there who is focused specifically on mental health as a service and as a benefit to folks. And they've provided now, so I certainly wanted to give them credit about some of the ways to support BIPOC mental health. And again, I can make the argument that these 6 steps, or these 6 ways to support would work for anyone, but they were gracious enough to mention specifically that this was built specifically to ensure that Black, Indigenous, and people of color in an organization are supported. Because again, I think it's very important to reemphasize that many of the systems that we have in place today, they don't necessarily work for everyone because they weren't built to. The folks who were in the room at the time that the benefit was established or thought about were not extremely diverse. So they obviously, again, I say this often, we tend to do things really well for ourselves that work for us. If I'm going to create something that's going to be perfect for me, it's difficult for me to make it helpful for other people without the involvement of other people. On my best day, even if I am, really, really interested in an ally and supportive, I just have my own experience. That's the only one that I have. And these kinds of issues aren't solved by me sitting in my office or sitting at my desk or whatever it is and creating it for someone else. This requires us to really work together. So the first area is building BIPOC representatives across organizational levels. Across organizational levels. And this is something that I observe. I find myself in lots of spaces where the folks who I relate to most are the ones who are providing service. Again, just had opportunity to speak at a conference in Australia a week and a half or so ago, and made this kind of observation even in my own presence, that a lot of the diversity that was present at the conference was the folks who were working at the hotel. And again, this happens for all kinds of reasons. It is not always an intentional exclusion, but it has to do with the career choices that folks have made, the access to education that people have or don't. And I pay attention to the levels of organizations that I interact with, and observed often, and still do observe often, that the diversity of the organization tends to stop at a certain level. Particularly when you get to the top, you tend to find some fairly homogeneous groups. And again, this is not that those are bad people, but if there isn't representation at that organizational level, it's going to be difficult to really understand or be taken seriously about conversations if you're interested at all. I mean, there are some organizations who are, for their various reasons, are beginning to kind of back away from conversations about diversity, equity, and inclusion. And again, particularly if you're in a private organization, you certainly have the right to do that. The challenge is, are you willing to accept the consequences associated with that? There's some talent that you won't get, and some customers you may not get. So again, it's important that there be representation at these levels, because the representation helps to create the kind of psychological safety. And this is I actually have a discussion about that coming up in another NSC webinar coming up later. But it's difficult to create a safe space for folks that you don't understand. And then even if you initiate these safe spaces, it's important that folks have a sense of community in these spaces. It's very important. So you can invite me to the room, but if I don't feel safe there because there's a kind of a lack of a culture of psychological health and safety, there are unmitigated psychosocial hazards in the environment. Again, not to get too far off into one of my favorite topics. So if you invite me to the building, to the room, to the space, but it's not really set up for me, there are going to be things there that could be injurious to me, that could be harmful to me, that you wouldn't even recognize, and that I may not even feel safe enough to bring up. So it's important that we not only have the representation, but have a sense of community within the space, so everybody feels like this is ours. This isn't theirs. This is ours. And we are here to cause this to be a safer place for all of us. It's important to communicate clearly and concisely the systems, including the benefits that are available to folks relative to mental health, to make it clear that it's not a secret. It's not. And again, as much as we put on EAP can't do everything. And many of our EAP systems definitely can't do everything, because they tend to be kind of under-resourced, or they've gotten kind of a negative connotation, that they get used as a kind of as a stick as opposed to a carrot. And again, this is not necessarily the fault of the EAP provider, nor is it's necessarily anyone's fault. But when people start to look at EAP as something that I don't know who those folks are, I only see them come around when negative things happen. So it's important that from the time that people come into the organization, these kinds of benefits that exist to support people's mental and emotional health, that they know what they are from the beginning, that they don't simply find out when they're in a crisis. Embracing cultural differences instead of assimilation is important, because we are all beautifully and wonderfully made, created, or evolved, depending on how you look at it. And our differences are our strength. They're not a weakness. And there is sometimes too much of a focus on assimilation and not enough on recognizing the differences and keeping them different intentionally, particularly as it has to do with me and the way I do my job, the way I accomplish things. I may do things differently. I probably do things differently just because of my life experience, just because of the way I see the world. But that's the value. That's what makes it so important. That's why you bring people into an organization that have different views. What would it be like if we were all exactly alike? It would be like the Borg. it is important that we recognize and highlight and celebrate the differences. As a matter of fact, celebrating differences is much better than tolerating them. Be helpful, not harmful, when responding to mental health concerns. Some of this goes back to the representation piece, because if there's not really a representation of the particular person that we're trying to help you, and not necessarily a sense of community, people tend to feel, I might feel that I'm simply here as a token. You certainly don't understand me, and the things that you do are triggering me, and they're not really helping me. So it's important that that efforts be made to help and not be harmful when responding, even to situations where mental health care situations come up, that we're responding in a careful and a helpful and in an understanding way. And at the same time, being honest about what we don't know and about what we don't understand, and not coming across as none of us can be an expert at everything. There's some areas that we don't understand other people's experience and what they're going through at the time. And it's important to really be clear about that and to be honest and open about that, because we are going to have to work together to make this work for all of us. And ultimately, expect that this is going to be hard. It is not going to be easy. If it were easy, everyone would do it. Expect there are going to be some challenges. Expect that we're all going to make some errors along the way, regardless to what our intent is. It's really important. And that acknowledgement, again, should happen at the beginning. We don't determine success at the end of a thing. We determine success at the beginning of the thing. And it's important when we begin the engagement. So when a person is hired and oriented, when they're promoted, when they're placed with a new group, that we set an expectation from the beginning about what this is and what it is not. The areas where we think we're doing fairly good, we're putting a lot of energy into, and the areas where we may not. And it is more intellectually honest and actually more helpful, particularly to, and I'd say it's this way for everyone. If you are honest up front that you're working at it, that you're attempting to, this is a journey. It's not something that you've necessarily solved. Because if you say you solved it, and you tell me that you solved it, I expect that you have. And I'll be extremely disappointed when I find out that you probably haven't. So again, it's just what it is. All organizations that are made up of human beings are fallible. We all, there is no perfect organization, no perfect job, no perfect situation. And again, it's going to require us working together and considering all of the voices that are going to be a part of whatever it is we're trying to do, of the organization, of the company, of the effort. All of our voices need to be a part of the discussion. So again, do expect that there are going to be challenges. Do expect, particularly those of you who are really, really interested in being different and breaking out of some of the old paradigms, that's going to be hard. You're going to get some resistance. And even some of the folks that you may be trying to help, may not always receive everything that you do exactly the way that you intend. But ultimately, this is about building relationships and creating environments that are ultimately going to be better, healthier, and safer for everyone involved. So hopefully some of that information was helpful to you. Again, and I'll, matter of fact, I should, let me put up a couple of things very quickly. I'm going to answer some questions for you. Again, a little bit of a shameless plug before I drop the slides. I did mention, or it was mentioned in the introduction, I do a podcast called the Psych, Health, and Safety USA podcast. Comes out once a week, and we talk about psychological health and safety related topics. So if you have some time, please do join us. And there's some contact information, should it be helpful. I'm going to stop sharing and see if we have any questions that folks want to present. This is, to me, always the most interesting time of any of these kinds of presentations because I, as a singular person, have a singular perspective on this and all the topics that I talk about. And, people may have other thoughts, may have other ideas about this, may have questions that they'd like to ask. And so perhaps we can address some of those together. So I'm not sure if there are questions already posted. If there aren't, I have other certainly topics I can add before we complete. So how are we doing do we have any questions?
Yes, so this is Morgan. I have opened, the Q&A is open. I don't see any questions at the moment. If anybody has any questions, feel free to pop them into the Q&A and we can get those over to Dr. Daniel so we can answer them.
Yeah, hopefully there are one or two. As I said, and I really do want to reemphasize that the pandemic was both a blessing and a curse. And that's an interesting thing to say, but there are some things that we learned had we not had a pandemic, we may not have learned them. And it certainly was a curse in many ways. The many organizations that didn't make it, and the loss of human life and the ongoing challenges from a physical and emotional perspective are just tragic. But go ahead.
No, I was gonna say, we have one question came in.
Okay.
This person says, I'm curious about how the prevalence of mental illness data was collected. I think when you went through those few graphs, it's possibly underdiagnosed in populations who could have less access to healthcare, including psychiatry. So they're wondering if it was self-reported or data collected, et cetera.
I have there were a number of sources, Mental Health America, the National Society for there's a Society for the Prevention of Suicide. There's a number of different sources out there relative to mental health related data, mental illness related data. And if you were to compare them, you're going to find that all the sources are even slightly different. Mm-hmm. And I'd argue part of this, some of this is my view, because again, as I said, this is not my full-time thing is looking into mental health related issues, but I do believe a lot of it has to do with stigma. Yep. It is difficult to collect data on a topic that some folks don't really want to talk about, or are concerned that if they talk about it, they're not sure the kind of reaction they're going to get. So the data sources come from all kinds of areas. Looking at some of the older, the report from 20 plus years ago, I thought that was interesting because it established a little bit that if I look this up today, you're probably going to hear some of the same things, that we do have some challenges in our healthcare system, but I myself wasn't aware that the prevalence of mental illness in BIPOC communities is really no greater than it is in the community as a whole. That for me was something that I wasn't aware of. The challenge is in the system itself, the system of how we treat it and how we get access for folks to mental health care. That's really the bigger issue, as opposed to how it presents in human beings. We all have different environments that we live in. We all have different, biological makeups, some that contribute to mental health challenges, some that do not. But it's actually easier to focus on the environment than it is to focus on people. I think we'd actually we'd be more successful, I believe, instead of trying to fix people, trying to fix the environments we put people into.
Yeah. Okay, another question came in. How should mental health challenges be handled without being seen as taboo or something to be frowned upon?
So mental health challenges, just like physical challenges. I mean, the Americans with Disability Act is, a generation or so old. We're still trying to figure our way. How do we deal with physical challenges in the workplace? And we're getting better. But the conversation around mental health has just not been as open. We've not been as open. So a lot of this is about creating a culture. And it goes back to the topic of psychological health and safety. They're all connected. How safe do people feel bringing up something that's different or that's not working well for them? How safe do they feel? And again, that if the organization is starting from scratch, that should be a part of how the organization is designed from the beginning. You're going to bring in human beings. Those human beings, when they come, they're going to come with challenges. They just are, because we're just not perfect. And if you're starting from scratch, it should be, and we are open to hearing what those differences are and what those challenges are, because we really value you as a person and realize that's a part of you. For legacy organizations, it depends, because the organization has been around for however long it's been around. It has a composition of whoever it has. So often it's about me and the other person who are having the conversation. The organization as a whole may not be interested, ready, or capable of addressing whatever my mental health challenge may be. So first of all, am I dealing with it? All this starts really with me. Do I, have I done the work that I need to do to understand that, yes, I do have a diagnosed mental illness, or I do have some down mental health days. So a lot of this conversation really starts with us looking in the mirror and going, look, we've all had some form of trauma at some point in our life. Every single one of us have. We all, and they affect us all different. So how am I dealing with that personally? Do I go to therapy? Am I open to having these conversations? And then who is the one other person that I can talk to, whether that be a family member, whether that be a therapist, whether that be a priest, a rabbi, our faith traditions. Where do I go to get charged up and to get, help when I'm having mental health challenges myself? And then how do I make myself available to others if they want to have that conversation with me? I think sometimes we start way too big. Really need to start smaller. Start what's going on with me and what's going on with the people closest to me. And then how do we expand that circle, and how do we expand that circle in a helpful and safe and accommodating and caring way?
All right. Next question. Do you believe younger generations will experience or feel they experience any less institutional racism than older generations have? And how would this impact the workplace?
I think it depends. If I'm not mistaken, Generation Z is the most diverse generation that we've ever had, at least here in the United States. Their views about the world are very different. Their views about each other are very different. And the challenge is what kind of environment they're going to find themselves in, because the organizations that they're going into are not all brand new. Many of them have been around. So, I find it interesting when I hear companies that talk about, I've been around for 150 or 160 years and, proudly serving whatever. But that doesn't land the same with everyone, because 150 years ago, a person like me may not have been able to be served there. And sometimes those things come up for those of us who have, who know some of that history. It doesn't necessarily land the same way. It's not about the intent. It just lands differently. So every person sees these kinds of issues different. Some will go into these environments and because they have because the way they see the world, they aren't going to see the barriers and the limitations. And what we're finding, particularly with Gen Z and Gen Alpha and younger millennials, if they don't feel welcome and if they don't feel accommodated and supported, they just won't stay as long because of the stress associated with it just feels different. It doesn't feel like I'm really being accepted here, so they'll find someplace else to go. And so it's just different. I mean, there really isn't a cookie cutter approach that's going to work for every organization. So again, back to the statement I made before, it's really important that we work on the environments themselves and not, not really even spend as much energy trying to make people different than who they are. How do we create a space so when people enter that space, no matter how old they are, how young they are, how tall they are, how short they are, what, their racial identity, their sexual identity, their gender identity, how do we make it safe for whoever shows up? And particularly, how do we make it safe for the people that we invite to participate? The person that we hire, the person that we add to our team, before they come to the team, we should be thinking about how can we make it safe for them in the orientation process after we've made the assessment of their basic skills and knowledge. So they have the bona fide occupational qualifications to do the job. Once we have that figure, we know that we're comfortable they can do the job. We should be asking more questions at that point about, so what about this thing? You may be our first female employee, our first gay employee, our first disabled employer, there has to be a first all the time. So obviously you got to start somewhere, but how do we have the conversation about how it's going to be safe for us? It's just, sometimes organizations will do this thing. Oh, we have to hire those people, whoever those people are, and we need to make it safe for them. You need to make it safe for yourself as well, because we have to exist in this environment. And we should be having that conversation, not, well, we're going to do these things and we're going to show people and see how they like it. It's no, let's us talk about what's safe for both of us, what works for both of us. No group is monolithic. Just because it's good for one Asian person doesn't mean it's good for another Asian person. Just because it's good for one non-English speaking person, I think it's really important that, again, we focus on environments that are safe and accepting of the people who are there and the people we're going to invite to come into that environment.
Yeah, no, I agree. That's definitely great insights there. What are some signs that a workplace might not be supportive of BIPOC mental health?
Well, one of the first signs is that it may not be supportive is when people look at the organization itself and don't see themselves. Because you're sending a message in terms of what the organization looks like to who you actually want to be there and who the organization is set up for. And that, again, it just kind of is what it is. It is what it is. So if the organization really isn't set up for me, it's probably not set up to really worry that much or be accommodating of my mental and emotional health, because it wasn't set up for me to begin with. So those are some just visually. And then even visually, if it visually looks diverse, looks accommodating, but the experience of people in the organization is not the same. So we hire lots of people, but our turnover, that particular group of people, is really high. That says, again, it's about the environment, that it really, so again, the whole issue around mental health is it's more of a reaction to the environment than it is something that the organization can really do anything about. You are going to hire people who have anxiety, depression, PTSD, and, agoraphobia, you name it. People could have all kinds of things. So the question is, how do you create an environment that is accepting of that? So this whole discussion about psychological safety, people bringing their whole self to the environment, means they bring their inabilities and their disabilities and they bring that with them as well. So are we really interested in addressing or creating an environment where when people bring these things, that we don't make it worse? So again, so there's no perfect scenario, but it is first about identifying what it is we're attempting to do and then working together to try to accomplish it.
Great. Yeah, that's a wonderful way to address it. How can organizations measure and improve their support for BIPOC mental health?
You can measure and support. I find that many, we as a society, we are really, really into quantitative measures of stuff. We tend to look for numbers and facts and figures and we miss out on all the available qualitative data that exists. So the best, how do we do this? Ask me. And when I make a suggestion, when I tell you what it is I need, give it to me, or at least try. A lot of these organizational modifications or changes that need to be made are not really hard if we want to. We have to want to. We have to be considerate enough of that other person and what it is that we're trying to do, and be willing that when they ask for assistance to actually give them what it is that they're asking for.
Yeah.
And sometimes the things that people are asking for, they're not big. It's, I had I have had a guest that'll be coming up on the podcast for someone who talked about the fact that people with dietary restrictions, in some cases, that's the reason why they don't come to the company or the organizational pick, because I have a dietary restriction. Nobody ever asked me. They don't even inquire. And that makes it difficult for me and that's where all the deals get made. They get made when people are eating, but because the way I eat is different, I either don't get invited or I'm looked at differently because I eat something different. You see what I mean? It is listening to what people have to say and having an environment that is open for people to say different things and to need different things. But it's important enough for us to have you, that we're willing to try that out and work together with you. So again, no organization can meet every single need that people have. It just doesn't exist. It doesn't exist, folks. There is no job out there that can meet every single need that you have. So let's stop looking for the perfect scenario. But the scenario can certainly get better so again, and I say this a lot, you don't do effective safety programming to people. You don't do it for people. You do it with people.
I like that. You do it with people. Well, we are coming up to the top of the hour, so I just want to give a big thank you for all of you who joined us today for this important discussion. We hope you found the insights that were shared valuable, and a big thank you to Dr. Daniels for such an informative and engaging presentation. I hope you all go and check out his podcast. I've been listening for the last few days since we've met, and it's super great. So just want to let everybody know the recording and slides will be sent out to all registrants within 48 hours. And thank you all for attending, and enjoy the rest of your day.
Thank you. Thank you.